So today we will do the Erb's point. So Erb's point is a point or an area of the brachial plexus where the 6 nerves they meet. So 6th nerve meeting point is called the Erb's point. So the nerves, they are the roots of the C5 and C6. Both of them, they unite to form the what is called upper trunk. And this upper trunk is further divided into anterior and the posterior division. So this is the anterior division, this is the posterior division. And from the upper trunk, there comes 2 branches. The upper one is called suprascapular branch, and the lower one is called nerve to subclavius. So in this way, 1, 2, 3, 4, 5 and 6. So 6 nerves they diverge or converge from here. So that's why it's called the 6th nerve meeting point. That is called the Erb's point. And this Erb's point, where it lies actually in the human body? So it lies just in the lower part of the side of the neck. This is the clavicle, this is the neck, and this is the shoulder. So the angle between the neck and the shoulder, and here lies the first rib with the scalene tubercle, the head, neck, the outer border of the first rib. So the brachial plexus comes from the cervical region C5, C6, C7, C8 and T1. And this plexus comes downward as the upper trunk, middle trunk and the lower trunk. The upper trunk then further divided into the anterior division and posterior division. And this upper trunk gives the branch, the suprascapular branch and nerve to subclavius. So Erb's point lies over here. So just near our neck, where the neck meets with the shoulder. So here lies our Erb's point, and automatically, so whenever there is an injury here, or whenever the angle between the neck and the shoulder increases, so it leads to the problem that is called the Erb's paralysis. So that's why we will discuss today what is the Erb's point and what is its clinical importance. So clinically, so this Erb's point is actually damaged, and this damage of the Erb's point lead to the many problems to the person. So whenever this point is damaged, so first we will discuss what are the causes of the damage to the Erb's point. So first cause is the direct injury. So direct injury means injury due to the bullet injury, or there may be sharp injury, the knife injury may be there, or some cut occurs here, or if you lift some heavy weight on your shoulder and in which your neck and the angle between the shoulder is increased, so these C5 and C6 nerves, they comes out of the intervertebral foramen. They are stretched and they are damaged. So anything which increases the angle between the neck and the shoulder can damage it. So this is the direct injury. Second is the indirect injury. So indirect injury occurs when this angle increases, as in lifting the heavy weight. By the porters in the seashore. So when they are lifting the heavy weight and transferring the heavy weight to some other part, so there are chances that Erb's point are damaged. Then it can also occur during the difficult vaginal delivery. Difficult vaginal delivery. So when the head of the baby is large and pelvis is small, then the extraction of the head of the baby from the vagina, it can also increase the angle between the shoulder and the neck. Again, the C5 and C6 nerve, they are uprooted and Earth's point is damaged. So this is another cause of the difficult vaginal delivery. Then any tumor around here, any tumor around it, it can damage the Earth's point. So they are the most common causes of the injury to the Earth's point. That lead to the, so whenever there is an injury to the Earth's point or Earth's point is damaged because of any of these causes, how the patient presents, what happens to the patient. So whenever we examine the patient who has suffered from the Earth's point injury, which is this Earth's point. So whenever the patient comes, the attitude of the patient is very important. The attitude of the patient is that his upper limb of the affected side gives a characteristic look. And what is that look is called? Policeman taking tip. Policeman taking tip. Or what others call the tip limb. So whenever you are caught in some traffic problem and you have to give some money to the policeman, see how the policeman is taking the bribe. So his arm is in this position. So what is the position of the arm? So this is the position of the upper limb. And if you examine the upper limb, what is the attitude of the arm? Arm is adducted and medially rotated. Adduction plus it is medially rotated. So this is adducted and medially rotated arm. And what about the elbow? See the elbow position and the forearm. So elbow is extended. Elbow. So elbow joint is extension. And what about the forearm? If you see the forearm, forearm is pronated. So forearm is pronated. So that is the attitude. And what about the wrist joint? See the wrist joint. So wrist joint is semi-flexed. It is not fully flexed, it is semi-flexed. And see the fingers. Fingers, they are also semi-flexed. Not fully flexed, semi-flexed. So that is the attitude of the wrist joint. So wrist joint is semi-flexed. And what about the fingers? Fingers, they are also semi-flexed. So this is the attitude of the upper limb, that is arm is adducted, forearm is pronated and hand is semi-flexed with the fingers. So this is the position. So person will come like this. So when such a condition is there, that is called the policeman taking tip. Or it is also called the waiter's hand. So when you go to some hotel, you have to give some money to the waiter. So waiter don't put his hand like this. He will just put like this. And you will put some money in the semi-flexed position. Here you put some money. That's why it's called the policeman taking tip or the waiter's hand. So why this attitude has occurred? Because of the injury of the C5 and the C6 root. So problem is in the roots. So what happens to the roots? When we examine it, so we have to give the explanation of the attitude of the arm. Why this has occurred? Then we have to give the answer and then we have to give the explanation as well. This is how to explain it. Now number one is arm is adducted. Why arm is adducted? Because abduction is lost. Abduction is not possible. Pause कर दो. Press. Arm is adducted. Why arm is adducted? Because abduction is lost. You see. So arm is cannot be abduction. So abduction, when the abduction is lost, then the arm becomes adducted. Then arm is medial rotated. So why there is a medial rotation? Because lateral rotation of the arm at the shoulder joint is lost. So this is the lost things. Patient cannot do the abduction because abductors of the shoulder joint, they are not working. Why arm is medial rotated? Because lateral rotation of the arm is not possible, or the muscle producing lateral rotation, they are paralyzed. Then elbow joint is extended. So if the elbow joint is extended, means flexors, they are lost. That the flexion muscles of the elbow, they are not working. Then it is forearm is pronated. Why it is pronated? Because supinators, they are lost. The antagonistic muscles, they are not working. Supination is not done, cannot be done. Then the wrist. What has happened to the wrist? We have said that in this condition, the wrist is semi-flexed. Why it is semi-flexed? Because extensors, they are weak, or extensors, they are not working. Then all the fingers of the hand, again, they are semi-flexed. Why they are semi-flexed? Again, because their extension is weak. Extension is weak. So extension of the fingers is not possible. So in this way we see that a group of muscles bringing the different type of the movements of the upper limb, they are not working. That's why in Ars injury, the attitude of the upper limb becomes policeman taking tip. Why? Because the contribution, so all the abductors and all these muscles bringing the movements at the shoulder joint, elbow joint, wrist joint and the metacarpophalangeal joints who are acting, they are not now working. So that is the problem. So because of the injury to the Ars point, the nerves which are having the root values C5 and C6, now their contribution from the elbow in the brachial plexus is lost. So those nerves whose value is only C5 and C6 and muscles supplied by them will be totally paralyzed. But muscles which are having the nerve supply other than the C5 and C6, they are not totally paralyzed. They can still act because those nerves, they are having the other root values as well. So these muscles, they will work, but they will work very lightly, or their contraction is weak. So when the muscles, they cannot work or contract properly, what we use the word? Not paralysis, we use the word paresis. So paresis means weakness. So some group of the muscles, they undergo paralysis. Who will go the paralysis? Whose root value is only C5 and C6. And a group of the muscles of the upper limb whose root value is C5 and C6 plus some other. C5, C6 plus, there may be C8, T1 may be there. Or C6, 7 may be there. So if the root value is this much, only C5, C6 contribution of these muscles and the nerve is lost, but other nerve roots, they are working well. So muscle will not undergo full paralysis but some weakness, that is called the paralysis. Paralysis means weakness of the muscle. So that's why, so now we will enumerate which are the muscles and which are the nerves which are involved in the urge paralysis. First we will do the, what are the muscles involved in the urge paralysis. Now we have made a list of the lost or damaged muscle. Number one, abductors, which are not working. And we know what are the abductor muscles at the shoulder joint. Number one, supraspinatus. Then deltoid. Because supraspinatus do the abduction from 0 degree to first 15 degree abduction. Deltoid is doing the abduction from 15 degree to the 90 degree. Then lateral rotation. So what are the lateral rotators of the shoulder joint? They are the sit. Formula to remember, that is supraspinatus, infraspinatus and teres minor. So these are the lateral rotators. So they are not working. Then flexor at the elbow joint, they are not working. What are the flexors at the elbow joint? All the muscles from the arm entering into the forearm, they are the flexors. What are these muscles? Number one, coracobrachialis. Coracobrachialis. Number two, biceps brachii. Number three, brachialis. So they are the flexors at the elbow joint. Then extensors. So the wrist joint is semi-flexed. Why semi-flexed? Because extensors, they are not working. And what are the names of the muscles of the extensors we have done? These muscles, the name of these muscles, they are extensor digitorum, extensor digiti minimi, extensor carpi radialis, longus and brevis, and extensor pollicis longus. So these are the list of the muscles which are doing the extension at the wrist joint. Then fingers, they are semi-flexed. Why? Because extensors, they are weak. What are the extensors of the fingers? They are the same as the extensors of the wrist joint. So we have made a list of the muscles which are not working and they have brought the upper limb in the atypical position. So let us discuss about their nerve supply. As we know, the supraspinatus is supplied by suprascapular nerve, which is branch of the urge point. And what is the root value of the supraspinatus, suprascapular nerve? C5 and C6. Then deltoid. What is the nerve supply of the deltoid? Axillary nerve or circumflex. What is the root value of the circumflex nerve or axillary nerve? C5, C6. Then infraspinatus. What is the nerve supply of infraspinatus? Again, suprascapular nerve. Then teres minor. What is the nerve supply of the teres minor? Axillary nerve. Axillary nerve gives the nerve to the teres minor with a pseudoganglion, if you remember. So again, the axillary nerve will supply it, or circumflex nerve will supply it. Then coracobrachialis muscle. What is the nerve supply of coracobrachialis? Musculocutaneous nerve. And what is the root value of the musculocutaneous? C5, C6. Axillary nerve, C5, C6. Then bicep brachii. What is the nerve supply of the bicep muscle? Again, musculocutaneous nerve. What is the nerve supply of the brachialis? Medial half is by the musculocutaneous and lateral half is by the radial nerve. So again, muscocutaneous nerve supplies it. Then all the extensor muscles, all extensor muscle of the elbow joint and the wrist joint, they are all supplied by the single nerve, that is the radial nerve. And what is the nerve supply of the root value of the radial nerve? C5, C6, C7, C8 and T1. So in this way we see that the C5 and C6 contribution to all these nerves, they are there. But upper these nerves, they are only having the root value of the C5 and C6. So what will happen? So nerves which are only having the contribution or the root value of C7, C6 and muscle supplied by them, they will be totally paralyzed. Because no nerve is coming to supply them. Only C5 and C6 is the dependent. But the radial nerve supplies the extensor muscles. Extensor at the elbow joint as well as the extensor at the wrist joint. If the C5, C6 is not contributed, but still the radial nerve is having C7, C8 and T1. So muscles will be working. Muscle will be contracting, but not of the full contraction. So these muscles supplied by the damaged radial nerve without contribution from C5 and C6 in the other paralysis, they undergo paralysis or working. Then the supination. Now we know which is the powerful supinator of the elbow joint. Powerful supinator of the elbow joint is the biceps. And bicep is supplied by the muscocutaneous nerve. So supination is not possible. That's why the arm is pronated. Because if the antagonistic muscle, opposite muscle, they are working and they are well, they will take the arm or the forearm or the wrist in their direction. So if the bicep is paralyzed, supinator muscles they are paralyzed, then pronator muscles they are okay. Because pronator muscle is, what is the pronation? What are the muscles which are doing the pronation? The supination is there. Pronation is there, supination is lost. So pronator muscles they are there. And what are the muscles of the pronation? Pronator teres and pronator quadratus. And what is the nerve supply of the pronator teres? The median nerve. What is the root value of the median nerve? C5, C6, C7, C8 and T1. And pronator quadratus. What is the nerve supply of the pronator quadratus? Anterior interosseous nerve. Anterior interosseous nerve. And what is the root? Anterior interosseous nerve again is the branch of median nerve. So same root value for the pronation. But in this median nerve, C5, C6 contribution is lost. Now it is damaged. Only C7, C8 and T1 nerve will supply the pronator teres as well as the pronator quadratus. So muscle, the whole of the forearm is pronated because pronators they are still working. Weakness is there, but still they can rotate the arm and they may bring about the pronation. So this is why how the muscles they are damaged, which muscle damage you should know the names of all these muscles. And you should know also the nerve supply of all these nerves, the root value. Then only you can explain why the attitude of the arm is policeman taking tip. So that is how you have to attempt the question of urge point or what is the urge paralysis with the causes, the group of the muscle involved and the nerve supply and the ill effect of this nerve supply. So this is how we finish with the urge point and the urge paralysis.